want to start off by saying that President Obama is expected really at any moment to break into programming with a statement on gun control. So we're going to bring that to you as soon as it happens, but we're going to continue on with our show for the meantime and talk about migraines, which so many of you can relate to. More than 28 million Americans suffer from migraines.
We're going to be talking about relief for you people suffering from migraines. Dr. Bahman Guyuron, a plastic surgeon at UH, is here to talk about a number of techniques, including facial rejuvenation. Welcome back, doctor.
Hi, doctor.
Thank you.
First
Great
off,
to be here.
How has plastic surgery expanded over the last 10 years?
It is vastly expanded, and for that reason, actually, we have divided the responsibilities between my associate partners in my department. Each one of us specializes in a particular part of plastic surgery because it's so hard to keep up with everything and be good at everything. So, for example, Dr. Stepnick and I do facial plastic surgery. Dr. Sultanian does breast surgery. We have Dr. Lakin, who's a craniofacial pediatric plastic surgeon. Dr. Rose, a laser specialist. And Dr. Becker does hand and peripheral nerve surgery.
Talk about this procedure, the whole facial rejuvenation, fat injection and removal, and how it works to help migraines.
What we discovered that with the forehead lifts,
yes,
we are eliminating some of the muscles that are irritating the nerves. The way Botox actually helps migraine patients. Botox paralyzes the muscles. And actually that's the creativity of the plastic surgeons, that we have converted a toxin to something to be helpful. We have converted a facelift to help the patient not only to look better, also to get rid of some of these migraine headaches.
Are you seeing more teenage patients coming in for cosmetic surgery, for rejuvenation, and even for migraine work?
Yes, we do. And the fact is that teenagers are very sensitive and they get devastated with a pimple. And when they have deformities or imperfections, correcting those makes them blossom, and all of a sudden the personality comes through and they become socially accepted and happier.
Yeah, having friends and even some family members that suffer from migraines, I just know from what they say, debilitating, like just horrible. How much help are we talking about? Is it gone from a procedure like this if you are one that really suffers, or is it just slightly better?
Holly, we have done about 24 studies, and we have demonstrated that actually 90% of the patients have at least 50% reduction in migraine headaches, and a good number of them are totally migraine-free.
That's amazing.
Yeah, it is extremely rewarding for us.
And lastly, doctor, we have about 45 seconds. Facial surgery myths. There's a lot of them out there. Can we touch on some of the most popular ones?
Absolutely. One of the ones that actually is major is the fact that people think that rejuvenation results are temporary. That's not the case. We turn the clock back and it goes forward, but it never catches up. For example, somebody who had 10 years rejuvenation will remain 10 years younger for the rest of her life. It is the fact that we are not stopping the gravity effect, and the changes are going to occur, but our results will last for the rest of a person's life.
All right, doctor, thank you so much for coming on the show, sharing this wonderful information.
Thanks for all you do.
If you want to contact the good doctor at University Hospital's Department of Plastic Surgery, you can do so by calling 440-646-2173, and you have a wonderful holiday season.
Yes.
Thank you.
All right.
You too.
Thank you very much.
University Hospital's Case Medical Center is consistently ranked among the nation's best hospitals by U.S. News & World Report. Learn more about this year's rankings at uhhospitals.org/quality.